Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
Welcome
Yeah,
to the Psychology Club podcast. I'm Evie. Today we are interviewing Mariella from Bay Area Community Resources about the fentanyl crisis. I'm going to start off the first question. What is fentanyl and how does fentanyl compare to heroin and other opioids in terms of potency and overdose risk?
thank you. Fentanyl right now is the strongest type of opioid that can be prescribed by a doctor or a health professional. It's prescribed by doctors for really extreme cases of pain. So think like spinal surgery, knee replacement. Sometimes it's even given to people before going into labor, so giving birth. Um, so, you know, we can imagine what kind of pain management um, fentanyl gives for really extreme cases of pain. In comparison to other opioids, as far as potency, it's up to 50 times more potent than heroin and up to 100 times more potent than morphine. And because it's so strong, doctors are prescribing it in very tiny amounts. When I say tiny, I mean 20 to 50 micrograms. For reference, 1,000 micrograms equal 1 milligram. So they're using just a fraction of an amount of a milligram to treat as much pain as giving birth. Okay, so they're doing that to, treat the pain of the patient without causing an overdose, obviously.
Hi, my name is Jeremy, and my question is, what are the demographics of people most affected by fentanyl overdoses?
Yeah, so it kind of, varies from state to state, but what we're seeing, at least according to the SAMHSA, I always get that acronym wrong. What we're seeing is non-Hispanic white people and non-Hispanic Black people who are among the highest, who are among the races and ethnicities that are most affected by opioid overdose. I think, some of us know that historically Black people have been disproportionately affected by addiction and overdose. And, unfortunately, with this current trend of the fentanyl crisis, we're sort of seeing that repeat of history.
Hi, Melissa. How are schools and communities educating young people about the dangers of fentanyl?
Yeah, so that's kind of where my work comes in. So what I do at BACR is I coordinate a coalition called the Contra Costa Meds Coalition. Really what we do is community education to prevent overdose and to prevent substance use disorder or addiction to prescription drugs. So what we have been doing so far is working with school districts to get this education out into the school community. So that means all encompassing, as in educating students, their parents or guardians, as well as the staff that work at the school. So right now, we most recently put on an event at Alhambra High, which was open to all of Martinez Unified. And we've worked with other neighboring school districts in West County and East County and Central County to put on parent fentanyl awareness events. So, we're trying to get the education out there. There's obviously still more work that needs to be done. Our hope is that we'll be able to educate in the classrooms, like me coming into the classroom and talking to students. But really it starts with the school district taking this issue and this topic seriously so that we can talk directly to students and bring this information to them.
Hi, Mackenzie. What are the challenges law enforcement faces in curbing fentanyl distribution?
Yeah, that's a good question. I don't have a super clear answer for that just because I don't work on the law enforcement side. but I know it's difficult to pinpoint where fentanyl is coming from, at least here in the county, and who's distributing it, especially because police are having to respond to overdoses so frequently instead of having the time to track down who's selling and who's dealing. But yeah, I don't have too much information on that side of things, but I'd be happy to connect you with someone from law enforcement if you have more questions about that.
Okay.
Hey, my name is Gavin. What impact has fentanyl had on first responders and healthcare providers? Or would that be like the same
Yeah,
for law enforcement?
I think it's kind of along the same lines, but I know that first responders and healthcare providers are needing to also respond to overdoses at much higher rates. They're having to use Narcan or Naloxone. When they get the call, they're having to reverse these overdoses because of the presence of fentanyl-laced pills. And what's really interesting about that and the rise in overdoses that we're seeing in the past 5 years is that a lot of them were accidental fentanyl overdoses, meaning that those who overdosed on fentanyl didn't even know they were taking it in the first place. They thought they were taking one drug, whether that be cocaine, Xanax, Oxy, or even Adderall, and had no idea that what they were taking was laced with fentanyl. I think that's what healthcare providers and first responders are mostly seeing.
What resources are available for families and individuals affected by fentanyl addiction?
Yeah, so there is the Contra Costa Behavioral Health Access Line, which is 888-678-7277. Basically, this number can be called for anything related to mental health or substance use. That's kind of what behavioral health means. So anything mental health or substance use related. Basically, someone can call this number 24 hours a day, 7 days a week. And if they need access to treatment or they're looking for resources, maybe like a support group, or they don't know like what treatment they can get based on the issue that they're having, they'll be connected to a provider. They'll kind of do like an intake, like assess what your needs are, and then they'll direct you to the appropriate resource from there.
What is being done at a policy level to address the fentanyl crisis?
Yeah, so there's a couple things that happened most recently, like within 2024 here in California. So there's a couple new state legislations. One of them states that any high school in California that requires a health education course to graduate must include fentanyl education into their curriculum. So yeah, if a high school says you need to take this health ed course in order to graduate from our school, during that health ed course, they have to include a course, a topic or a week's worth of curriculum, for example, specifically on fentanyl and the fentanyl crisis. That has to be implemented by the 2027-2028 school year, so just in a couple of years. But this is a really impactful law that was just passed because it really ensures that all teenagers are educated on fentanyl before graduating and before moving into adulthood past, K-12 schooling. Another piece of legislation that passed this year was about how middle and high school students in California are now allowed to carry Naloxone or Narcan while on campus. I think the rule or the law used to be that you had to be 18 in order to carry it on campus, but now middle and high school students are allowed to carry and they can't get in trouble for it, for having it at school. So I think, I'm in total support of this personally. I think it really breaks down the stigma of carrying naloxone and the assumption that everyone's using drugs. It's kind of just, I think this law makes it seem more like this is a safety measure, that people are carrying it, kind of like keeping a first aid kit in a classroom or keeping a Band-Aid in your backpack in case someone gets cut, right?
How does fentanyl contamination happen in other drugs, and what motivates dealers to lace drugs with it?
Yeah, so really dealers are lacing their supply with fentanyl for two main reasons. The first is how strong of an opioid fentanyl is and how cheap it is, or how cheap fentanyl is. So it's cheap to either buy in bulk or to make themselves. And it's cheaper for them to use fentanyl as a filler instead of mimicking the actual ingredients of the pill they're trying to sell. So let's say, for example, a drug dealer is trying to sell Xanax. It's much cheaper for them to use fentanyl and make it look like Xanax than to use what's actually in Xanax to make their pills. It's just much cheaper. They profit more off of it, or they make more money by using cheap fentanyl. The other reason is because of how strong it is. So right, in the beginning, I mentioned that fentanyl is the strongest opioid that can be prescribed right now. And so if dealers are using fentanyl to lace their supply, it's driving addiction rates up among their customers. And that means that their customers are going to keep going back to them, right? Because that customer is like, well, now I know that this dealer has the really strong stuff that I want, so I'm going to keep going back to them.
What can individuals and communities do to help prevent fentanyl-related deaths?
Yeah, I mean, the biggest thing is just awareness and education, just like attending educational events, spreading the word and what you've learned to family and friends also just normalizes the topic. I think a lot of the times people don't want to talk about drug use or talk about addiction because it is an uncomfortable topic, right? Especially if we know someone personally who's struggling with it, or if, you know, I myself am having issues with substance use and now I have to talk about it with my parents. Like, it can be really uncomfortable. But starting that conversation and coming from a place of, I want to learn more, or I care about this person, is really the best way to have a meaningful conversation and also to prevent more of these fentanyl related deaths from happening.
And what are the stats on fentanyl versus like prescription opioid deaths?
Yeah, so I guess with a prescription versus an opioid death, what we're seeing, at least in California, is that I want to say 2022 is the latest stats we have. 80% of all opioid deaths that happened in California were caused by fentanyl. So that's the highest that we've ever seen fentanyl take up in relation to opioid overdose deaths. And that equates almost 6,000 deaths. So 5,900 deaths in California were due to fentanyl specifically when we're looking at opioids as a whole.
Why is fentanyl showing up in so many illegal drugs now?
Yeah, I mean, like I mentioned in why dealers are using it is because it's just so cheap. Drug dealers have figured out how to make it themselves, make fentanyl themselves out of a really like specific mixture of chemicals that I couldn't even tell you what they are. Or because they found a supplier who will sell it to them for cheaper than if they were to buy the actual prescriptions. We're also seeing it because there are before fentanyl even came about in the street drug supply, there are already people who had opioid addictions, right? Whether that be to heroin, to oxy, right? Any other type of opioid. But now those people who have those addictions have moved on to fentanyl because it's just that much stronger. They're having to use less of the drug, but it still gives off that really intense high, which is why we see so many people turning to fentanyl as their drug of choice, I should say.
What role do social media and online platforms play in the distribution of fake pills laced with them?
Yeah, so that's what's really interesting about this new like fentanyl crisis, or I guess in the past 5 years now, is that social media and the dark web, or some people call it other things, are playing such huge roles in why this crisis is so huge. So like people are using anonymous social media platforms like Snapchat, Reddit, and Telegram to deal to their customers, or for customers to talk to their dealers, because it's super easy to hide behind fake accounts with those social media platforms. It doesn't require as much like human verification as some other platforms do, like Instagram and Facebook. So it's easier to make like an anonymous account, which makes it harder for law enforcement to track them down through these platforms, because it's usually more often than not connected to a specific person, or the dealer will delete and create new accounts pretty frequently so that they don't have like they're not easy to track. If that makes sense.
How do you tell a real prescription drug versus a fake?
Yeah, so the only way to know if a prescription drug is real is to get it from a pharmacy. There's no way to tell just by looking at it whether it's real or fake. So the only prescription pills that are real are the ones you're filling at a pharmacy by getting a prescription written up from your doctor. The DEA, or the Drug Enforcement Agency, which is a federal agency that deals with like illegal drug trafficking, they are the ones who like seize or bust a bunch of pills from drug dealers. And in 2023, they found that 7 out of 10 pills that are being sold or dealt illegally are laced with fentanyl. So that means when people choose to purchase their pills from anywhere besides a legitimate pharmacy, they have at least a 70% chance of, coming across something that's laced. So yeah, unfortunately, drug dealers are good at making their pills or their supply look and feel exactly the same as a prescription one. So the only way to really verify is to get it from a real source and not from a dealer.
How does Narcan work?
Yeah, so Narcan is a brand name of a nasal spray that uses the medication called Naloxone to reverse an overdose on opioids. So Narcan is kind of the famous brand name, like how everyone calls ibuprofen Advil. Ibuprofen is the actual medication. Naloxone is the actual medication in Narcan. So it kind of looks like an allergy nasal spray. And if someone is overdosing on an opioid, so like fentanyl, oxy, morphine, Norco are some examples of that, someone can spray this Narcan medication into their nose, and it'll reverse their overdose and essentially save their life.
What drugs will Narcan reverse? Like, is there any drugs that
Yeah,
it
so
doesn't work for?
it only works on opioids. So any prescription painkiller like fentanyl, like oxy, morphine, Norco. It's not going to work on a sedative like Xanax. So if someone's overdosing on Xanax, that's not going to work unless it was laced with fentanyl. But the really good thing about Narcan is that you can give it to someone who you think is overdosing. And if it turns out they're not overdosing or they're overdosing on something else, they'll be completely fine. So there's nothing bad will happen to them if you give them Narcan and it turns out they're not overdosing. So, I could spray Narcan up my nose right now and nothing bad would happen to me. So it's only a safe medication. Can't really do any harm to someone. So I always say, like, when in doubt, if you think someone's just overdosing in general, just give it to them. Worst case scenario, they didn't need it.
Thank you.
How can you get Narcan?
So there's a couple ways. Narcan is now available at pharmacies. It kind of varies where you go. So most recently I went to a Target and it was like stocked on the shelves near the pharmacy. Other pharmacies will have it like behind the pharmacist's window. So you have to talk to the pharmacist in order to get it. Or you can also get it from some nearby hospitals will have it available just like at their front desk. But you can also ask your doctor for a prescription for it, and sometimes your insurance will cover it.
How do you know when to administer Narcan?
Yeah, so knowing when to administer Narcan means knowing the signs of overdose. So the main signs you want to look for are slow, shallow, or irregular breathing. So that can look like maybe they're only taking one breath every like 10 seconds, or it's really hard to tell if they're breathing at all. Sometimes their lips or their fingers might turn a different color, like a blue or purple or gray, depending on their skin tone. They'll either be passed out or really close to passing out, and they could even be making like a snoring or a choking sound. Basically, when someone's overdosing, they're not getting enough air into their body. They don't have enough oxygen. Their oxygen levels are low, and that's what causes the overdose. So once you've identified that in someone, you can give them Narcan, and that'll get their breathing back to normal.
Where are the most overdoses occurring in Contra Costa County?
Yeah, I don't know off the top of my head which like zip code in particular has the highest. What I want to say is that it's happening all over the county, but we're seeing kind of hot spots or higher rates of overdose in West County, like the Richmond, San Pablo area, and then also in East County, more in the Antioch, Oakley area, and then some hot spots over in Central County, like Concord as well.
What amount of fentanyl is deadly?
So it only takes 2 milligrams of fentanyl to cause an overdose and kill someone if they're not rescued or if Narcan isn't given to them. 2 milligrams looks like a couple grains of salt or a fraction of a raindrop. So that tiny amount of fentanyl laced into a pill that's up to like 30 or 50 milligrams in size can cause an overdose pretty instantly.
Is touching or breathing in fentanyl dangerous, or do you just have to ingest it?
Yeah, so you can't overdose on fentanyl simply by touching it, whether that be a pill or a powder. It can't be like absorbed through the skin and cause an overdose, but you can overdose from cross-contamination. So let's say there was leftover fentanyl powder on like a table at a restaurant I went to. If I put that same hand in my mouth or like anywhere in my nose, that's considered cross-contamination, and I could overdose from that. So if you think you might have touched fentanyl or been exposed to it, doctors just recommend disinfecting with soap and water.
Thank you so much, Mariella, for joining us today on the Psychology Club podcast. And thank you for our listeners for tuning in. Don't forget to like, subscribe, and share our channel for more inspirational content. See you next time.